Anorexia nervosa is one of two main studied eating disorders. As described by Arkelus and Associates, anorexia is a mental disorder that involves drastic changes in eating behaviors. The textbook, Carlson's Physiology of Behavior, 12th edition, describes a possible cause of anorexia, that being brain changes. A person's genetics play a role. It is not certain that it is due to genetics, but one can hypothesize because research has been conducted on twins with anorexia nervosa, which can mean that heredity plays a role in developing anorexia nervosa. The article, Accommodations of Symptoms in Anorexia Nervosa, a qualitative study, mentioned that anorexia nervosa can be linked to internal and external triggers, separation, stressors, and neurological predispositions. Some form of treatments include medication, cognitive behavioral therapy, as well as other forms of therapy. Antipsychotics have been used to help stimulate the adrenergic receptors, L-DOPA, as well as the THC. As for cognitive behavioral therapy, the psychiatrist will work with the patient through issues of body image, self-esteem, and negative feelings towards food. There was a different approach taken when treating anorexia nervosa as discussed in Mandometer treatment of Australian patients with eating disorders. In the approach, anorexia nervosa patients were subject to eat very fast. Then they were moved immediately right after to a very warm room. The goal of the study was to lower the patient's anxiety. The results seemed to be extremely successful. In an updated letter by Philip Gray, he mentions that years after the study was conducted, no further research has been done. The reasons are uncertain, although it does show promising future treatment. It also shows the impact that anxiety plays in anorexia nervosa. If you go into Google and type in anorexia is caused by, the first suggestion that will appear is anorexia is caused by society's pressure to be perfect. There is a common misconception when it comes to the cause of anorexia. Many people believe that anorexia develops solely due to exposure. Take, for instance, a 16-year-old girl suffering of anorexia. The common misconception is that her environment caused her to become anorexic. She read one too many cosmopolitan articles on how to lose weight, she watched one too many runway shows, and or watched shows such as Gossip Girl, Pretty Little Liars, and 90210. The article, Motivations for Reading Beauty Fashion Magazines and Anorexia Risk in College-Age Women's Results, indicated that there was an increase in behaviors and thinking associated with anorexia after exposed to beauty magazines. There is no doubt that one could be influenced and shaped by our environment. In this case, exposure to what we know as American beauty standards. Although, if exposure were the sole cause of an eating disorder, then the number of people diagnosed with anorexia would be much higher. In the case of adolescents, one might argue that they were simply not exposed to it. Although, according to the article, Exploring Adolescents' Views of Body Image, the Influence of Media, 16 to 17 hours are spent watching television shows each week, with an additional 20 to 40 hours watching movies and playing video games and being on one's cell phone. According to the 2008 article, Screening High School Students for Eating Disorders, Results of a National Initiative, the percent of reported adolescents diagnosed with anorexia nervosa was only 0.09%. Today, the percent of adolescents diagnosed with anorexia nervosa is 1%, even though we now live in a time where American beauty standards are not as prevalent. We live in the time of body acceptance and body positivity. The environment we live in has changed. It's a different social climate, which means that if social factors were the leading cause of anorexia, then there would be a decrease of adolescents diagnosed with anorexia. That is not the case. The percentage of adolescents being diagnosed with anorexia nervosa has not decreased, which helps us to believe that there's other broader causes. Neuroscience plays a factor. It's not just the environment. Much like in the Swiss cheese model of addiction, as discussed in class, there are layers behind why a person develops anorexia nervosa. The exposure is more of a reinforcement rather than a cause. Anorexia could be caused by different neurological factors, although one that is overlooked is trauma. Trauma is an exposure to an extremely stressful situation. Some common causes of trauma are violence, sexual assault, and death of a loved one. There is a correlation between childhood trauma and anorexia nervosa as studied in the article, Childhood Trauma and Cortisol Awakening Response in Symptomatic Patients with Anorexia Nervosa and Bulimia Nervosa. Children that develop trauma become more likely to develop anxiety, depression, and post-traumatic stress disorder. The system that is involved with trauma is the endogenous response system. According to PubMed, the endogenous response system is involved in regulating stress response. The stress that results from trauma affects the endogenous response system, but most importantly, the hypothalamic pituitary adrenal axis. It causes changes in the hypothalamic pituitary adrenal axis activity. It is possible to have a dysregulation even as a healthy person, but those changes do not last long, nor do they compare to the ones that occur in PTSD patients. The results also indicated that women who had experienced sexual trauma or post-traumatic stress disorder appeared to have lower levels of cortisol as compared to women that did not have sexual trauma, which leads me into the research discussed in the following article. In the article, military sexual trauma is associated with eating disorders while combat trauma is not. It was reported that a total of 66% of female participants had military sexual trauma. Sexual trauma ranges from rape, sexual harassment, catcalling, and inappropriate requests. The results show that these women had twice the chance of developing an eating disorder. The women that were studied turned to anorexia nervosa as a defense mechanism. The women studied had high levels of anxiety as a result of sexual trauma. Extreme dieting and weight loss helped them cope with their anxiety. They believed that losing weight would make them less appealing. If they are less sexually appealing, then they will not have to endure any more sexual assault. In addition, these women's combat trauma was also studied. Only 32% reported being exposed to combat. The researchers also studied the combat trauma to anorexia nervosa, but were unable to find any correlation between combat trauma and anorexia nervosa. There is a social stigma that comes with anorexia. It's this belief that people, or specifically women, want to look a certain way, that they want to have a body like Taylor Swift or Kendall Jenner. We reinforce this false stigma by telling girls that they are beautiful and that they don't have to change. We introduce Barbies with real women bodies. We introduce plus-size models into mainstream media. All of this is done with good intentions, but it does not help with a deep issue. Neuroscience plays a huge factor. A large number of anorexia patients report having trauma. It becomes a domino effect. First is trauma. That trauma is not professionally treated. Since it's not treated, people then find a way to treat that stress and anxiety. One of those self-treatments is anorexia. Throughout my research, there was one thing that every article mentioned. They all stated that eating disorders have the highest mortality rate of all mental illnesses. Little research has been conducted on anorexia patients with history of trauma. If more research could be done, then we could go about this issue the right way, instead of focusing so much on what the media portrays or social influences.